Welcome to Palliative Care Explained, a channel aimed at answering your questions about palliative care. My name is Dr. Jonathan Wong, and I am a palliative care doctor based out of Winnipeg, Canada. In this video, we will be discussing what the phrase quality of life means in the context of a patient with a serious or life-threatening illness. It is a phrase that is commonly used. But what does it actually mean? Let's talk about it. Please see the first introductory video of this channel for information about me, my declaration that I do not have any conflicts of interest or financial sponsors, and the medical legal disclaimer statement. Link in the description box below. So what does quality of life even mean? Exploring the concept of quality of life is a dedicated field of study with lots of different definitions and meanings. It can be defined on a broad population level, as well as on an individual level, and of course, all the levels in between. Now, the nuances of how these are different are far beyond the scope of this video. But let's talk about quality of life as it relates to healthcare on an individual patient level and in the context of a patient with a serious or life-threatening illness. Many people associate the term quality of life with the absence of physical symptoms or the absence of suffering. Although having no symptoms is usually thought to be better than having lots of symptoms, I have encountered many patients with what I consider to be a significant symptom load. But they felt they had great enjoyment in life due to their connectedness with other facets of their lives. On the other hand, I have encountered many patients with what I perceive to be minimal or manageable physical symptoms, but due to various forms of isolation and their lack of connectedness, they felt absolutely miserable. This goes to highlight the importance of social interactions, relationships, and a sense of connectedness. Human beings are generally social creatures, but I can appreciate how some people enjoy their solitude and desire to have less social interactions, while some are more extroverted and simply crave social interactions. And both, and everything in between, are okay. We are all different. But what is a common thread among humans is this desire to feel connected to something. And that something can vary greatly. So combining both academic and medical definitions, I would describe quality of life as a patient's ability to enjoy and feel connected with all the different meaningful components of their life, and with a manageable symptom burden that allows for them to enjoy these different components. And these components can include, but are certainly not limited to, family connectedness, spiritual connectedness, psychological health and the presence of supports, a sense of belonging in their environment, and wherever and whatever that might be, and incorporating that particular patient's values, preferences, and goals. Looking at the first half of this definition of quality of life, I want to emphasize these next points. I think quality of life is much, much more than simply being able to perform normal daily activities. As well, the components that we seek connection with and the assigned value of these components will vary from person to person. It is very subjective and specific to a particular patient, their life lived, and their priorities. In the second half of the definition of quality of life, please notice that I said manageable symptoms. For many patients, having zero symptoms is not a realistically achievable goal, at least not without significant side effects. Our goal then, as consistent with the goal of palliative care, is to strive to get the physical symptoms to a manageable level as best as we can, while balancing it with the side effects of medications and treatments. And I'll be honest with you here, sometimes that can feel like walking on a tightrope. Achieving such a balance can only happen with open communication between your healthcare providers and you, your family, and your caregivers. So to summarize this video, quality of life is a patient's ability to enjoy and feel connected with all the different meaningful components of their life, and with a manageable symptom burden that allows for them to actually enjoy these different components. This will mean different things to different patients, so it is really important for patients to reflect on what is most important to them. Thank you very much for watching this video.